Okay, so our presentation's on social skills training. My name is Miranda Burley.
And I'm Amber Rudder. So what are social skills? Social skills are the skills that we use to communicate and interact with each other, both verbally and non-verbally, through gestures, body language, and our personal appearance.
The intended client group, so its importance of social skill instruction for individuals with disabilities. Individuals with disabilities may lack adequate social interaction skills. They may have low levels of interaction through communication disorders or difficulties, display inappropriate behavior such as loudness or talking to strangers, also exhibit high levels of aggression while not being able to channel that anger differently, also be viewed as unskilled.
Why are social skills important? Good social skills are necessary to become a part of most social groups. Belonging to a social group can reduce or eliminate feelings of isolation and promote overall improved social, mental, and emotional well-being.
So the population focus, the individuals with intellectual disabilities, autism spectrum disorders, schizophrenia, persistent mental disorders, intellectual disabilities, and then behavioral disorders in children. These are just the examples that were given in the book, but there's also many different populations that deal with social skills issues.
So the importance of social skills. Lack of social interaction skills puts individuals at higher risk of future failure because of the interrelationship between social competence and other long-term functions, such as work and leisure participation. The lack of social competence decreases the potential of positives such as landing a job, meeting and socializing with others, social acceptance and friendships, and positive self-regard.
Lack of social skills in general with individuals with disabilities, they may experience skill deficits, may lack motivation and cognitive abilities to apply positive social behaviors, also may misread nonverbal communication, and then may lack prerequisite social behavior to be successful with peers.
Individuals with disabilities may experience low social status among peers without disabilities, are not well accepted by their peers without disabilities, have fewer friendships, have low participation rates in school-related and out-of-school activities, and experience more loneliness and isolation.
Also, with life adjustment, children with disabilities import interpersonal skills. So they usually do not generally outgrow their social deficits without direction or extensive intervention. Also, usually demonstrate academic underachievement. Also, may face psychological problems and then show tendencies toward juvenile delinquency.
So for adults with social skills, adults with intellectual disabilities living in a community residential facilities often don't develop reciprocal relationships with other individuals that do not have disabilities, and they also most likely won't make new friends during recreation participation within the community. And social skills of the individual are not the same skills that are needed to be successfully integrated into the community.
They also might not feel that social skills are important because of the age that they're at, and it's important for within their setting for them to be taught those social skills. So cautions and considerations. This is in teaching social skills with rec therapy. So this includes social interaction is reciprocal and involves some sort of social exchange among individuals and individuals with disabilities, lack for peer models. Training also must take place in settings with appropriate peers for new skills to be taught. And teaching social skills is very complex. To teach a child any kind of social skills, it takes a lot emotionally, physically, and they may get discouraged very easily, so it's pretty tough to do.
So the application to therapeutic recreation, the leisure ability model provides examples of client goals and intervention, discussion of the need for true friendships among those with and without disabilities, and the need for inclusive community recreation programs and facilities.
So the activity that we're doing is emotion charades. So what emotion charades is, it's a fun social learning game. It gives opportunity to explore emotions. It helps participants identify when others are feeling certain emotions, which is very important with appropriate social interaction. Also, naming emotions will help the ability to communicate more effectively and talk about feelings. It also gives the chance to hear and use feeling words in a non-threatening way.
So, charades is evidence-based. We found a study from Marlene B. Shippers, Valeria Gazzola, and Christian Kaisers. So they had 12 couples come and play charades and then participate in an fMRI scan that measures brain activity. And the study found that players observing gestures, so they were observing the charades, they experienced enhanced activity in the temporal parietal junction, which is a part of the brain associated with reflecting on mental states of other people. So overall, you can conclude that charades encourage people to think from other points of view and perspectives, and it works on nonverbal communication skills.
And here's all of our references.